So I'm very happy to ask Chonge Kitojo from the PMI team in Tanzania to come up and speak to us. She's going to provide a little bit more context about the ANC surveillance, which was mentioned in Frank Chaki's talk. So thank you, Chonge.
Okay. Good morning, everyone. As Julie said, my name is Chonge Kitojo. I work for PMI Tanzania, and I'm glad today to present to you results of our study conducted in Tanzania, specifically focusing on comparing malaria prevalence data from antenatal clinics with household survey data. So on behalf of my co-authors, I'm very happy to present on their behalf, and most of them are in this room today. So let me give you a little bit of background. As you may know, surveillance forms a key pillar of global technical strategy, whereby most countries need more accurate and timely data to be able to monitor trends in disease incidence and prevalence, and also to be able to evaluate coverage and impact of intervention, as well as be able to direct resources and target malaria intervention where needed most, especially areas where malaria is of high risk. And again, accurate and timely data will help countries to inform supply chain, making sure that countries are able to make better quantification for malaria commodities and also distribution of malaria commodities according to the needs. Let me give you a little bit of information on the data collection systems that I think most countries and even Tanzania are using. The basic ones are the routine health system, which utilize health management information systems. And also on the other side, we have the population surveys, the household surveys, mainly malaria indicator survey, and demographic health survey. So these data collection systems have their own advantages and also some disadvantages. So if we start with routine data, most of the time using routine data, we'll be able to get continuous data and also estimates of entire population age range, and also distributed according to population density. And most of the time, routine data are not very expensive if you compare with population survey data. However, despite the advantages that we're having, routine health data have their own disadvantages as well. So mostly the routine data underestimate true burden of malaria infection. And this is because of variability in care seeking. And also we won't be able to get asymptomatic infection. And also, as we know, health management information system suffers from poor data quality. But on the other hand, also using routine data, we won't be able to measure, to get data on intervention coverage, such as bed nets. So if I moved on the other side of household survey, using household survey, we'll be able to estimate both true infection prevalence and also coverage of intervention. And this is something that we won't be able to get through the routine data. Again, household surveys as well have some disadvantage. As you know, they are conducted periodically from every 2 to 5 years, so you really won't be able to get real-time data and continuous data. Again, there are done at national and regional level. So using population survey data, you won't be able to get data at the lowest level of administrative structure. So, and again, only sample children under 5 and very expensive and sometimes can be logistically very challenging. So now countries are thinking of having new tools. I think we heard Chucky talking about ANC surveillance. They use data from the ANC to do stratification. So yes, it could be a very good opportunity for countries to get data. As you may know, pregnant women are easy access group to reach, and they attend ANC almost throughout the year. So having said that, we will be able to get continuous real-time data, and it could be also cost-effective and maybe sustainable. Again, pregnant women may be a representative sample of the population, as we may know that most African countries, pregnant women make for first ANC. As we can see on, as we can see on this graph, almost 90% of pregnant women make for first ANC throughout African countries. So on the other hand, we will be able also to assess infection prevalence using ANC data, because if women are attending first ANC and get treated regardless of symptoms, then we might be able to assess infection prevalence. So here, let me get you to some background of our project and what is happening in Tanzania, and also in relation to the objective of our study. So in 2014, Tanzania introduced a test and treat policy, whereby all pregnant women attending first ANC are being tested using MRDT, and for those who are positive, are treated according to national guidelines. Again, for those who are negative, will be given IPT. So the objective of our study, we wanted to compare malaria test results to the two national population surveys. The population surveys which measure prevalence on children under 5 years of age. By doing that, we are hoping we'll be able to examine the potential use of ANC data to measure malaria trends and also progress towards malaria elimination. As part of the methodology for our study, as I mentioned earlier, we wanted to compare ANC data with population survey data. So for ANC data, we got malaria prevalence in pregnant women. We collected data from over 8,000 facilities in Tanzania. And also, these facilities are coming from all 184 districts of Tanzania. And again, these data are coming from Health Management Information System. We did the project, this data, the period from 2014 to December 2017. So for survey data, which measure prevalence in children under 5 years of age, we use Demographic Health Survey 2015-2016, and also we use Malaria Indicator Survey 2017. So we wanted also to do correlation between ANC and survey data. So the regional level correlation was assessed using Pearson's correlation coefficient, and then we also wanted to assess the ability of the data to measure heterogeneity beyond the regional level. So we use Kendall correlation coefficient. On this slide, I would like to give you some information on cluster samples for both data set. For both data set, malaria indicator survey, demographic health survey, and also for the ANC. As you can see on these maps, the first left-hand side map represent cluster samples for malaria indicators survey and demographic health survey. As you can see, about 20,000 children were tested in these two surveys. On the right-hand side, you'll see map represent ANC. As you can see, almost 160,000 women are being tested every month. So I think now you can start appreciating high coverage in ANC data compared to malaria indicator survey. On this slide, as I mentioned earlier, that we wanted to do the correlation between ANC and demographic health survey data. So from this graph, as you can see, the correlation is good. The red dot represent malaria indicator survey 2017. And the blue purple dots represent demographic health survey 2015-2016. As you can see, correlation is very good, 0.83. Apologies, there is a percentage there. But again, we did also check data outside Tanzania, as according to the study done by Van Eyck. So I think from this slide, you will appreciate the good correlation between ANC and demographic health survey prevalence. Again, ANC data can provide you with information, very useful information to do stratification of malaria burden. So Tanzania used ANC data to do stratification, as Chucky pointed out. But what I would like to emphasize here on these maps, these are the maps from population survey. This is 2015-2016 demographic health survey, and this is 2017 malaria indicators survey. And these two maps represent data from the ANC. So as you can see, most of the time, malaria indicator survey and demographic health survey shows, for example, if we take this northern part of Tanzania, shows almost zero prevalence of malaria using children under 5. But when you come to ANC, you can see how ANC data can provide you with more information, especially where infection is still going on, even if at the higher level, using demographic health survey and malaria indicator survey, you get to see prevalence is 0. So again, also not only on the areas where malaria is low, even if you check here, this Lindi region is almost all red. But if you check on ANC, you can see only maybe 2 districts that are having high malaria prevalence. So this is very important for NMCP to use data for stratification, and Chucky talked about this. I don't have to repeat much, but ANC will provide us with very useful data for making decision on even where to target some of the interventions. Again, on this slide, I would like to provide you with more information as we get from the use of ANC data, especially in providing substantial spatial and temporal information. So for this slide, these first graphs we represent different regions of Tanzania and from different zones. So we have Singida Central Zone, Morogoro Eastern Zone, Tanga Northern Zone, and Lindi Southern Zone. So this first dotted line represents the testing uptake for ANC. As you can see, it improved over time, and now in most areas is almost reaching 100%. These red dots represent malaria prevalence for children under 5, as has been highlighted by the population survey data, malaria indicator survey, and demographic survey. So you can see in all regions. And these lines represent malaria prevalence using ANC data, and these are district level trends. So if I start with the blue lines, these blue lines represent districts where where are having very low prevalence rate, and the darker red lines represent districts which are having high malaria prevalence. So I think you can now start appreciating how useful it is. ANC data can provide us very useful information, especially seeing dynamics of infection, not only in the region, but within even by district. So NMCP will be able to see where infection is happening, even if malaria indicator survey is showing very, very low prevalence. But what we are seeing using ANC data, you have some districts that are having high prevalence, even though the regional level prevalence might be low. So again, this is very useful information for NMCP to be able to make decisions on targeting of intervention and also see trends over time. So on this slide also, I would like to provide you with additional information, especially how ANC data can help us capturing progress toward regional elimination. As you may have known that in low prevalence areas in Tanzania, especially regions such as Arusha, Kilimanjaro, and Manyara, most of the time the population survey data, meaning malaria indicator survey 2017, and also malaria demographic health survey 2015 show zero prevalence. That means they didn't pick up any positive samples in this region. As you can see, these black yellow dots represent zero malaria prevalence in one of the region, which is Manyara region. So population survey will not be able to capture trends in areas where malaria is very, very low. But because of the large sample of the ANC data, we were able to capture some trends in areas where malaria is very, very low, and population survey couldn't pick any positive sample. This is very important as we are moving towards malaria elimination, but the good thing is malaria prevalence in pregnant women also showing declining trends. So NMCP will be able to monitor what is happening within the region that are having very, very low malaria prevalence. So in summary, what we are saying is that based on the analysis we did, we have seen malaria prevalence in ANC correlates very well with the data from population surveys. And again, as I presented, ANC data has a potential to provide a much greater and spatial temporal granularity than DHS and malaria indicator survey. Again, as I mentioned earlier, we will be able to use ANC data to track trends over time, and also it could be a low-cost solution to monitor malaria prevalence in real time, and also we can be able to assess response to intervention. So my last point is that pregnant women may also be a good source of data for coverage of intervention, especially bed nets, but this need further validation before we make that conclusion. Again, I would like to thank you, all my co-authors from all these organizations. And if you want more information, please check out our Lancet paper, which has been recently published. Thank you.